Since the girls are virgins and they've not been exposed to the virus, why are they being vaccinated?
I don't think that child will ever get that virus when the child starts any sexual intercourse. It is the best way to protect or to prevent cervical cancer in children.
Nigeria, we no go carry last.
The Cancer on the Street podcast is an African cancer community, collecting wisdom and connecting one another through head and heart conversations and street vibes. Each episode weaves stories from scientists and researchers generating new knowledge, cancer survivors and changemakers sharing their stories of hope. The Cancer on the Street podcast is for extraordinary people by the people's oncology.
Welcome, my favorite people. My name is Dr. Omolola Salako, and I am so excited to welcome you to another episode, Cancer on the Street podcast. Today, I have a very, very special guest. She's a nurse. She's Matron Funke Anifoshe. Welcome, madam.
Thank you so much, Dr. Lola Salako.
You know, I must tell you something about Matron Anifoshe. She's one of my favorite nurses. Like, is there anyone of you watching that has not been cared for by a nurse? I doubt it. She's one of my favorite nurses because typical of nurses, they're caring, they're dedicated, they stay with patients, nurse them till they are feeling well and they can go home. And even when patients get home, they're able to follow them up. They take care of our babies, they take care of moms. So this is me giving it up to all the nurses around the world and to you, Matron Funke Anifoshe, for the great work you do, taking care of millions of people. So first question I'm going to ask you, why did you choose nursing? Why nursing?
I really have passion taking care of people, even from while I was a baby. And when the pariah part came, I had to jump at it. And to be precise, I love bedside nursing, taking care of patients, anybody that is very sick. And that's why I chose nursing.
Excellent. So one thing I know about you is you've done phenomenal work over the years. I've known you for more than 5 years, and you've done, you've been so committed to ensuring that women don't have cancer. You are at the forefront of preventing cancer. At the last count, I know you have screened more than 5,000 women for breast and cervical cancer at Sebeccly Cancer Care and also at Pearl Oncology. And I'm overwhelmed because whilst we've done a lot in screening women, the fact that you have actually screened more than 5,000 women and you've helped these women get better health or prevent cancer is something that deserves recognition or an award. How do you feel about it, knowing that you have contributed to reducing the cancer burden in Nigeria?
You know, when it comes to cancer, it's a burden, and there are myths surrounding it. And when it comes to community screening, which is where you can get more women to screen, you get to meet a lot of women. Some, they are diligent. I mean, they are not exposed. They've not heard about cancer before. They've not done the test before. They are just, they are clueless. Let me just put it that way. But when we go for community screening and we meet all these women, we make them comfortable. We explain the process, which is very, very seamless. The only problem we have is people that we cannot really communicate with, like deaf and dumb. But we still try our best to make sure that they know the process. And when you come for community screening, like I said, it's another ball game altogether. But in all community screening, before you start any screening, you must give an health talk so that you make sure that they know at least what they come for. And community screening, giving health talk means we are trying to prevent, we are trying to detect anything that could lead to cancer. Because if you don't detect it, you cannot prevent it before it gets to a full-blown stage. And we've gotten so many cases that as soon as we get it, we cancel them and they go for treatments and they are very, 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 very okay. It is not that we don't get people that are already in third stage, fourth stage, but those people, we give them a referral immediately to the hospital.
Okay, so let me track back a bit. Two things that have stood out as you were responding. The first part is you've actually encountered quite a number of women with disabilities. So when you go into the communities, like I know you've been to more than 100 communities screening hundreds of women, in one setting where you have about 10 nurses and you're screening, hundreds of women every day. And amongst these women, there are different classes, the high income, the middle income, the low income. There are those that are educated, there are those that are not educated. And here you're saying that you actually would, talk to them before you screen them so that you can educate them, get their consent, and then they come into your screening room, which is private. However, there are some women that are deaf and dumb, like they can't even hear what you're saying. Or they can't speak. So do you get translators? How do you go about that?
Okay, thank you, doctor. In some cases, all this deaf and dumb, they can write. They can actually write. They don't really speak, but they hear what you say. But with little sign language, because I mimic them. Want to write you want to write your name, paper, something like that. They'll say that you should give them the paper. So they write, they complete the form, and they read, they understand. Then those ones, they are easy to deal with. But there are some they cannot hear, they cannot read. They themselves, they come with their own translator that will help them, even going with them to do the screening. And they will indicate that is my sister, is my daughter, is my friend, that they are comfortable for the person to come in to the screening room. So we have such women. And it has been very, very fantastic.
Wow. And that's, again, one thing I love about nurses. They are very creative. You guys are creative. Like you see problems on the field and you don't back down. You actually create solutions to ensure that that person understands, that person gets screened, and you achieve the goal for the day. So well done, Matron.
Thank you so much.
Another thing I admire about you is the fact that you have trained many nurses in this area. And I know Sebeccly Cancer Care is at the forefront of screening women. They've screened more than 30,000 women so far for breast and cervical cancer. And as we move into various communities, sometimes you have to bring on new nurses, and sometimes they know how to screen. Sometimes they need an update. And you're, again, at the you're leading the team and you're training them. What's that like, training the younger generation?
Okay, yes. Some of these young nurses, they are not really taught how to carry out cervical screening, breast screening while in school. It is when they come out, when they start working, and it depends on the organization that they join. Anyone that comes or joins Sebeccly or PEL, we train them. Or if you have a large outreach, we need to train some nurses. We've trained government nurses, we train we train doctors for cervical screening, and they are doing great. But in Sebeccly, all our nurses, they are great. They know how to carry out this screening seamlessly.
That's good. Okay, so let's go let's talk about our women, the women we screen, that we invite to come for breast or cervical screening. One thing I've noticed, and I would love your opinion on this, is that some women are just scared of screening. They feel that whatever they are going to do for them in that screening room will pain them. They just are scared. They've heard that they will press the breast, it will pain them. they will put something inside the private part, it will pain them. And because of that, they are not going to get screened. What's your experience with that?
I've had a lot of experience when it comes to that. You know, let me give you an example. If you are doing a large screening, because we do set up, we have our waiting area, we have our registration area, and we have the screening room. The screening room sometimes might be very close to the waiting area, sometimes it might be far. But in a case that it is very close to the waiting area and the women are sitting and they know that the next room, this screening is going on. Sometimes when they hear a woman shout, you see all of them be like,
sit up, like,
what is going on? I don't think I'm going to do it too.
But where are the women shouting when being screened?
Thank you. You know, number one, we have different pain threshold. Some they don't even like anything touching them when it comes to, they want to go down there. They don't want anything to touch them. After explaining to them and they are willing, they'll be like, is it painful? Is it going to pain me? We'll just explain to them that this is not painful, but it is just a little bit uncomfortable. And once we insert the speculum, and this speculum we are talking about is a disposable speculum that is just one for each woman.
And it comes in different sizes. Depending on
the woman. We have the small, the medium, and the large, depending on the woman. So even at that, you see some women, they will still shout. But in some cases, when I see a woman that this man might shout, and a shout will discourage others, I'll just tell her, madam, you need to take a breath. And if you know you are going to make noise, please just use your hand and cover your mouth. Even if you are going to shout, don't let people outside think or you discourage them. If you now say no problem, then at the end of the day, they cooperate and they do it. But once they come out and they go out, they'll be like, it's painful. This one, that one. Those will be like, it seems that I'm not going to do it again, no. So the nurse outside be like, no, it's not like that. It's not painful. And you see some when they come, you will not see them make pain. And they will check themselves, will check them, they'll fine, they come out, they will even thank you. They're like, thank you very much. In fact, I've not done this test before. This is my very first time. But some will say, I've done it 3 years ago. And those are the ones that I look up to. Those are that have done it like 3 years ago because they know the process. Once they come like that, they know how to climb the bed, they know how to position themselves.
And they're calmer than the very first time. And I think that's a great point because a lot of people we have screened are being screened for the first time. So there's that anxiety that comes with the first timers.
Exactly.
I also know there are a group of other women that are very ticklish. They are laughing when...
Why you are... That's very funny. That's very true. That is their nature. Even you touch them like this, you see them, they laugh.
Giggling.
They giggle. And you'll be like, madam, what is it? She'll keep laughing until when she calms down. You say it's not painful, there's nothing, just relax. Then at the end of the day, we go through the process and they're fine, they're okay.
So Matron, for a lot of women watching, some may have been screened before and a lot have not been screened. Based on the work we do, we see that a lot of women were screened for the first time this year when we went into various communities. I would like you to walk them through when a lady walks into your screening room. What are the steps that you would take from beginning to the end?
Okay. If you come for cervical screening, as you walk in, we welcome you, you sit down, we make you comfortable. We will explain briefly the process. That is breast and cervical. That is what you come for. We will give you a consent form. The consent form has so many informations and it's an informed consent where you need to read a part, which you need to sign. If you are comfortable with it, you sign and you go ahead with the screening. If you are not comfortable, you decline. Then we have the lower part of the form is where we write the result, because after the examination, cervical examination, we detach and give you your results. Once your result is negative, your breast is normal, there's no lump, there's nothing detected, you come back in the next 3 years, and we encourage you to go for HPV vaccine, because it is a human papillomavirus that causes cervical cancer. Then come for your vaccine.
Okay. So thank you for, sharing those points. You've touched on a very important topic, human papilloma virus, the virus and the vaccination. And a lot of people are not even interested in the vaccination going on right now in Nigeria. The federal government has rolled out a free vaccination program for girls in primary health care centers, and young girls from the age of 9 who are the best beneficiary for these vaccines are not showing up as much as they should, because their parents and guardians don't understand if it is good or bad. But the truth, what we know is that HPV, chronic infection with HPV, is the number 1 cause of cervical cancer. So from your experience, how are parents, mothers, the women you screen, what are they saying about vaccination for the younger girls?
Okay. Thank you so much, Doctor. I would rather say for years back, up till this 2023, we've not really had problems, because we do tell the mothers that from 9 years to 15 years, they can bring their children, both boy and girl, for vaccination, and they agree. And you see some mothers, they are willing. They'll say, okay, I don't mind. Where do I bring my child to? Where do I go to? So that my child can take this. That I myself, I even want to take the vaccine. And they've been turning up. We've been given the vaccine. As far as I'm concerned, we've been given the vaccine. There's not been so much problem about it.
Okay. Well, maybe because that's on the private setting but in the public setting, there's a resistance to the vaccine. And I think it's coming from a few mischievous people. Whilst the government has good intentions to roll out, I think 7 million vaccines to vaccinate young girls, a few mischievous people have come up with this, rumors and myths that the vaccines will disvirgin the girls, the vaccines will cause infertility, and that since the girls are virgins and they've not been exposed to the virus, why are they being vaccinated? What do you think? What would you, if someone comes up with those excuses, what would you tell them?
Okay, I would rather say, is it not possible, is it not better to prevent something before it happens? If a child is not exposed sexually and there's a vaccine to prevent it, I don't think that child will ever get that virus when the child starts any sexual intercourse.
When they're older.
When they are older. It's just like giving our babies all these vaccines that they give from birth. BCG to prevent tuberculosis, oral polio to prevent polio, and all sorts, HPV vaccine. And all mothers can attest, and they can even say they know. They have the records of all these vaccines for their babies. And their babies are thriving. They are doing very well. They are 20, they are 30, they are 40. Even we that we are sitting down, we got the vaccines, and nothing is happening to us. It is the same thing with this HPV vaccine. It is the best way to protect or to prevent cervical cancer in children.
And so to you, my lovely viewers, I want you to know the following things. 1, cervical cancer is preventable. 2, you should go for your screening. And there are 3 types of screening. There's the pap smear, there's the visual inspection with acetic acid, and there's the HPV DNA screening, which checks if you have the virus or not. Whichever one you can afford, make sure you book your appointment and you get the screening done. Number 3, there's free vaccination going on across many primary healthcare centers. Your daughter will benefit from the vaccination. As an oncologist, I treat cervical cancer patients, and 99% of them have cervical cancer because they had sex a while ago and they had the virus, they contracted the virus, and the virus stayed on their cervix for 10, 20, 30 years. If only they had screened, we would have detected it early. If only those women had been vaccinated when they were young girls, they would not have even developed cervical cancer. So today we have a fantastic opportunity to ensure that we have a generation free from cervical cancer. There are many African countries that are winning the fight against cancer, like Rwanda. More than 70% of their girls have been vaccinated. Nigeria, we no go carry last. Please, let's bring out our girls. In future, I want to beat my chest knowing that we have created awareness for girls to get vaccinated, and they shouldn't be coming to my table as cancer patients simply because mommy, daddy, or someone said, don't get vaccinated. Give the girls give the girls an opportunity to prevent cervical cancer in future. Thank you guys for tuning in to today's episode. Please don't forget to subscribe to Cancer on the Street podcast on Apple, Spotify, and all other social media platforms showing on your screen right now. Also, I'd like you to share, retweet, tweet, post, repost about Cancer on the Street podcast. And if you want to take it a step further, you can actually change your Wi-Fi name in your office or at home to listen to Cancer on the Street podcast. We'll be back next week for another episode. Thank you.